Breaking at 9:47 this morning, 50,000 NHS nurses stood at the edge of a decision that could collapse Britain's healthcare system overnight. Not a strike, not a walkout, a mass resignation. The fluorescent lights in hospital corridors across England flicker the same as they always have. The beeping of life support machines continues its rhythmic pulse. But in staff rooms from Manchester to Brighton, migrant nurses, the ones who held this nation together through COVID, through endless winters of chaos, are filling out exit paperwork. Their hands shake as they write. The reason? A policy announcement from Keir Starmer's government that landed like a grenade 4 days ago. A single immigration reform buried in bureaucratic language. Indefinite leave to remain, the legal right to settle permanently in the UK after 5 years of service, has been doubled to 10 years. 10 years of uncertainty. 10 years of being tied to exploitative employers. 10 years of paying taxes while being denied child benefits, disability support, and the basic dignity of calling Britain home. Witnesses say the silence in some wards is deafening. One senior matron at a London teaching hospital reportedly broke down in tears during her shift. Subscribe now, because what happens in the next 17 minutes could determine whether your local A&E stays open next month. This isn't about politics. This is about survival. And the clock is ticking. To understand how Britain arrived at this moment, you have to go back to the pandemic. March 2020, the world locked down. The NHS, already stretched, already underfunded, faced the unthinkable. Hospitals overflowed. Ventilators ran out. Doctors and nurses worked 36-hour shifts in plastic gowns, watching patients drown in their own lungs. Britain needed help, and help came from the Philippines, from India, from Nigeria, from Ghana, from Zimbabwe. Nurses who left their own families behind, who boarded flights into the unknown, who arrived in a country that promised them a future. Over 200,000 internationally educated nurses now work in the UK. 1 in every 4 nurses wearing an NHS badge is foreign-born. They are the backbone of the system. They staff the night shifts no one else will take. They work in understaffed care homes where British-born nurses have long since fled. The deal was simple. Come to Britain, work hard, pay your taxes. After 5 years, apply for indefinite leave to remain, the legal status that transforms you from temporary migrant to permanent resident. ILR means you can switch jobs without sponsorship. It means you can access the same welfare system you've been paying into. It means you belong. But this was no ordinary promise. Since 2021, 76,876 healthcare workers entered the UK on skilled worker visas, most on the health and care worker pathway. They came during the darkest days of Delta and Omicron. They held the hands of dying patients when families couldn't visit. They worked through applause on doorsteps and then through the silence that followed when the nation moved on. Many are now just months away from qualifying for ILR. They've been counting down, planning, saving for the £3,029 application fee per person, a fee that cost the government just £523 to process, but has become a lucrative revenue stream. Then came the political shift. Nigel Farage's Reform UK has been surging in the polls. Immigration has become toxic again. Starmer's Labour government, elected on promises to fix the NHS, found itself trapped between 2 realities. They need migrant workers desperately, but they also need to look tough on migration. On November 20, 2025, Home Secretary Shabana Mahmood announced a new policy: indefinite leave to remain qualifying period, extended from 5 years to 10. For lower skilled workers, those below degree level, 15 years. The government framed it as reform, as fairness, as a contribution-based system where migrants must earn their place through higher tax payments, volunteering, and English proficiency tests. But to the nurses reading the announcement in hospital break rooms, it felt like betrayal. Sources close to the Royal College of Nursing say the organization was blindsided. No consultation, no warning, just a policy document dropped on a Wednesday morning, with a public consultation promised imminently, a consultation that would come far too late for the thousands already planning their departure. The mathematics of despair are brutal. A nurse who arrived in 2021 expected to apply for ILR in 2026. Now that date has moved to 2031. Another 5 years of limbo. Another 5 years unable to access child benefits while paying income tax and national insurance. Another 5 years tied to a single employer because their visa is sponsored. And switching jobs means starting the sponsorship process again. Resetting the clock. The Royal College of Nursing moved quickly. Within 72 hours, they surveyed over 5,000 migrant nursing staff. The results were catastrophic. 60 of nurses without ILR said the policy change was very likely to affect their plans to stay in the UK. Do the math. 76,876 healthcare workers who arrived since 2021. 60% of them reconsidering. That's more than 46,000 nurses. Add in those who arrived slightly earlier, still waiting for their 5-year mark. The number climbs to 50,000 nurses. In a system already short 47,000 full-time posts, Professor Nicola Ranger, General Secretary of the RCN, called the proposals immoral. She said migrant workers were being used as political footballs. She warned of threats to patient safety, of collapsing waiting times, of an NHS workforce crisis unlike anything Britain has ever seen. But this was about more than numbers. It was about a Nigerian nurse named Grace who worked through COVID, contracted the virus twice, and hasn't seen her two children in Lagos since 2021. She'd been saving for them to join her once she got iller. Now that reunion has been pushed back 5 more years. Her daughter will be 13 by then. Almost grown. It was about Rayesh, a charge nurse in intensive care in Birmingham, who took out a loan to pay the visa fees for himself, his wife, and his son. He'd calculated he could pay it off by 2027 once he had iller and could switch to a better paying trust. Now he's locked in, trapped by debt and a visa that chains him to his current employer. It was about Maria, a care home worker in Cornwall, who works 50-hour weeks for minimum wage because the care sector is exempt from salary requirements for visa sponsorship. She has no union protection, no ability to negotiate, because her employer knows she cannot leave without losing her visa status. And now she must endure this for 15 years, not 10, because her role is classified as lower skilled. The care sector is already in freefall. Overseas recruitment of care workers was shut down entirely in July 2025 under previous immigration restrictions. The few remaining migrant care workers are the last threads holding together a system that cares for Britain's most vulnerable. And now those threads are fraying. The government's response was measured, clinical. A spokesperson said they were grateful to overseas healthcare workers but insisted net migration must come down. They promised a contribution-based model where migrants could reduce the qualifying period through integration efforts, but integration cannot be measured in tax revenue and English tests. Integration happens in the small moments, in the gentle way a Filipino nurse reassures a frightened elderly patient, in the prayers a Ghanaian nurse whispers over a stillbirth, in the curries an Indian nurse brings to share with exhausted colleagues during a night shift. The nurses who came to Britain didn't come for money. Many took pay cuts to work here. They came because they believed in the NHS. They came because Britain asked them to, and now Britain was asking them to wait, to prove themselves again, to accept a new contract they never signed. As the news spread through hospital wards and care homes, something began to shift. Quiet conversations turned into urgent phone calls. Migrant nurse WhatsApp groups usually filled with shift swap requests and encouragement filled with screenshots of job postings. In Canada, in Australia, in New Zealand, in Ireland, countries where nurses are valued, where the path to permanent residency is clear, where 5 years still means 5 years, the Royal College of Nursing issued a formal demand: scrap the policy, protect the nurses who protected Britain. But the government did not blink. And so the crisis moved into its next phase. Not political debate, not negotiation, escalation. By Friday morning, the story had broken wide open. The Guardian's front page carried the headline in bold black type: 50 Lowell nurses threatened to quit over Starmer immigration policy. BBC News led with it at 6 am. Sky News ran it on loop. Social media erupted. Within hours, #SaveOurNurses was trending across the UK. But beneath the hashtag, the nation was fracturing. Some saw betrayal, others saw necessity. And in hospital corridors across England, migrant nurses watched a country argue over their worth. At 7:32 am, a video began circulating on Twitter, filmed on a phone, shaky footage from inside what appears to be a staff room at an East London hospital. A Filipino nurse, her face obscured, her voice trembling, speaks directly to the camera. "I came here in 2022. I left my husband and my 2 daughters. I worked through Omicron. I held patients' hands when they died alone because their families couldn't visit. I haven't hugged my children in 3 years. And now they tell me I have to wait 10 years? 10 years before I'm allowed to feel like I belong here?" Her voice cracks. "I'm going to Australia. My family deserves better than this." The video was viewed 2.3 million times by lunchtime. The response was immediate, and it was divided. One user wrote, These nurses saved my father's life during COVID. This policy is disgraceful. Will them everything, another replied. We need to control immigration. If they don't like it, they can leave. Plenty of British nurses need jobs. But that argument collapsed under scrutiny. There aren't plenty of British nurses. There are 47,000 nursing vacancies across the NHS. The domestic nursing workforce has been shrinking for years, ground down by low pay, impossible conditions, and a government that clapped for them on Thursdays and then froze their wages. By mid-morning, the Royal College of Nursing held an emergency press conference. Professor Nicola Ranger stood at the podium, her face etched with exhaustion and fury. These proposals are not just immoral, they are dangerous. Let me be absolutely clear. If the government proceeds with this policy, we are looking at the single largest workforce exodus in NHS history. 50,000 nurses gone, not in 10 years. In the next 6 months, a reporter shouted a question. What will that mean for patients? Ranger didn't hesitate. It will mean longer waits, cancelled surgeries, ward closures, A&E departments unable to staff night shifts, maternity units shutting down, elderly patients left in soiled beds because there is no one to care for them. It will mean preventable deaths. The room went silent. She continued. And let's be clear about who this hurts most. Not the wealthy, who can pay for private care. This will devastate the working class communities that rely on the NHS, the very people this government claims to represent. Within an hour, the statement was everywhere, but the government did not respond. At midday, the hospital workers began to speak out. Dr. Amara Okonkwo, a consultant at a Manchester teaching hospital, gave an interview to BBC Radio 4. Her voice was calm, but her words cut deep. I supervise a ward with 80 nurses. 11 of them are migrants. This morning, 3 of them came to my office in tears. They wanted to know if I thought they should leave. What do I tell them? That Britain values them. Because this policy says otherwise. She paused. I trained some of these nurses myself. They are phenomenal. They work harder than anyone I've ever seen. And now they're being told they're not good enough, that they need to prove themselves for a decade. It's grotesque. In Leicester, a senior midwife named Patience, originally from Zimbabwe, spoke to ITV News. She held her 5-year-old daughter's hand as she spoke. I delivered 347 babies last year. I worked through COVID when I was 6 months pregnant myself because the unit was so short-staffed. My daughter was born here. She's British, but I'm not allowed to be. Not for another 5 years. How do I explain that to her? The testimonies piled up, each one more heartbreaking than the last. A care home worker in Devon said she was sexually harassed by a resident's family member but couldn't report it because she feared her employer would revoke her visa sponsorship. A mental health nurse in Glasgow said he'd been denied a promotion 3 times because his visa status made him too complicated to transfer between NHS trusts. An oncology nurse in Liverpool said she'd been working 70-hour weeks because her ward was so understaffed, but couldn't switch to a less demanding role without risking her immigration status. These were not abstractions. These were not statistics. These were the people keeping Britain alive. And Britain was tearing itself apart over whether they deserved to stay. By early afternoon, the political pressure began to mount. Labour backbenchers started to break ranks. Sarah Owen, MP for Luton North, tweeted, "We cannot build an NHS fit for the future by driving away the workers who hold it together now. The PM must reconsider." Zara Sultana, MP for Coventry South, was more blunt. "This is a betrayal of the people who saved lives during COVID. Starmer is playing Farage's game and ordinary people will pay the price in blood." But the Labour leadership held firm. At 3:00 p.m., a Downing Street spokesperson issued a brief statement. The Prime Minister recognizes the vital contribution of overseas healthcare workers. However, the British people voted for controlled immigration. "We are committed to a fair system that rewards contribution while reducing net migration. We encourage all stakeholders to participate in the upcoming consultation." The statement landed like a slap. Consultation? Ranger said in a follow-up interview. What consultation? The policy has already been announced. The damage is already done. Nurses are already booking flights. She was right. By late afternoon, reports were emerging from recruitment agencies. Calls from NHS nurses inquiring about positions in Toronto, in Melbourne, in Auckland, in Dublin. One recruiter in Sydney told The Telegraph, "My phone hasn't stopped ringing. We've had more inquiries from UK-based nurses in the last 48 hours than in the previous 6 months combined." Canada was particularly appealing. Its express entry immigration system offered permanent residency in as little as 6 months for healthcare workers. Australia was fast-tracking nurse visas. Ireland, English-speaking, European, familiar, was welcoming them with open arms. Britain was hemorrhaging talent in real time, and still, the streets had not yet stirred. But that was about to change. At 5:47 p.m. The Royal College of Nursing announced a national demonstration. Saturday, London, Parliament Square. We are calling on all healthcare workers, migrant and British-born alike, to stand together. This is not about us versus them. This is about whether we value the people who care for us when we are most vulnerable. The response was instantaneous. Within 2 hours, 12,000 people had arrived to the Facebook event. By midnight, it was 34,000, but the anger was spreading beyond healthcare workers. Patient advocacy groups joined the call. HUK released a statement warning that the policy would devastate elderly care. The MS Society said it would endanger vulnerable disabled people who rely on migrant carers. Even some Conservative MPs began to voice concern. Jeremy Hunt, former Health Secretary, gave a rare interview to Channel 4 News. "Look, I understand the political pressure on immigration. I really do. But we cannot cut off our nose to spite our face. The NHS runs on migrant workers. If we lose 50,000 nurses, we are looking at a catastrophe." He chose his words carefully, but the message was clear. This was not sustainable. By Saturday morning, the streets of central London began to fill, nurses in scrubs, doctors in white coats, care workers in high-vis jackets, and patients, hundreds of patients, some in wheelchairs, some on crutches, some holding signs that read, "My nurse saved my life. Don't send her away." The crowd swelled. 34,000 became 50,000, then 70,000. Parliament Square was a sea of people. Chants echoed off the stone facades of Westminster. What do we want? Fair treatment. When do we want it? Now. Migrant nurses here to stay. Starmer's policy? No way. A Ghanaian nurse named Abina stood at the microphone, her voice booming through the speakers. "I came to this country because I believed in the NHS. I believed in Britain. And now Britain is telling me I am not enough. Well, I am enough. We are enough. And if you don't want us, there are plenty of countries that do." The crowd roared. She continued, tears streaming down her face. "But I don't want to leave. I love this country. I love my patients. I love the people I work with. So I am begging this government to see us as human beings, not political pawns." Her words cut through the cold November air, and for a moment, it felt like something might shift. But inside Number 10, the Prime Minister was facing a different kind of pressure. Polling data had just landed on his desk. Reform UK was now polling at 23% nationally, just 4 points behind Labour. Nigel Farage had released a statement earlier that morning, calling the nursing protest emotional blackmail and demanding the government hold the line on immigration. Starmer was trapped. Soften the policy, and he'd be accused of caving to pressure and losing control of the borders. Hold firm, and he'd watch the NHS collapse in real time. At 6:34 p.m., as the demonstration in Parliament Square reached its peak, news broke. The government would not be backing down. A senior cabinet source, speaking anonymously to the BBC, said, "We sympathize with these workers. We truly do. But we have to think about the long-term sustainability of immigration policy. We cannot make exceptions every time there is public pressure." The statement was leaked deliberately, a signal, a line in the sand, and with that, the crisis moved beyond protest. It moved toward confrontation, because the nurses had a decision to make: stay and endure another 5 years of uncertainty, or leave and watch the system they loved collapse behind them. By Sunday morning, the first resignations began to appear. Not 50,000, not yet, but enough to be felt. A ward in Nottingham lost 4 nurses overnight. An ICU in Bristol lost 3. A care home in Cardiff lost its entire night shift, and the question hanging over Britain was no longer if the crisis would escalate. It was how soon the breaking point would come. Monday morning, November 24th, 6:47 a.m., the Royal Free Hospital in North London operates with 60% nursing capacity. 2 wards are closed. Elective surgeries, hip replacements, cataract removals, hernia repairs are cancelled. Patients who have waited 9 months are told to wait longer. The A&E department is on diversion protocol, turning away ambulances and sending them to other hospitals already drowning in demand. The reason is simple. Overnight, 11 nurses submitted their resignations, all migrants, all citing the same reason: "I cannot build a life in a country that sees me as temporary." This is not an isolated incident. Across the country, Hospitals are reporting the same pattern. Quiet, polite, devastating resignations. Nurses who have worked through hell are walking away, not in fury, but in exhaustion. In heartbreak. At 8:15 am, the Royal College of Nursing releases new data. In the 72 hours since the policy announcement, 1,247 migrant nurses have formally resigned from NHS positions. Another 3,891 have submitted inquiries to international recruitment agencies. The hemorrhage has begun. NHS England tries to downplay it. A spokesperson says resignations are within normal fluctuation and that the health service is resilient, but the numbers tell a different story. By mid-morning, the British Medical Association representing doctors breaks its silence. Dr. Latifa Patel, chair of the BIMA Council, holds a press conference outside BIMA House in London. Let me be very clear. The NHS is not resilient. It is barely functioning. We are held together by the goodwill of exhausted staff who work far beyond their contracted hours because they care about patients. And now the government has decided to test just how much more those staff can take. She looks directly into the camera. We are watching our colleagues' brilliant, dedicated professionals being forced out of this country by a policy that is both cruel and economically illiterate. Training a single nurse costs £70,000. We are hemorrhaging billions of pounds in human capital because of political posturing. A journalist asks, will doctors join the nurses in protest? Patel pauses. Then she says something no one expected. We are considering all options, including industrial action. The room erupts. Doctors and nurses, together. The prospect of a joint strike, something not seen since the darkest days of conservative austerity, suddenly feels real. By noon, Downing Street can no longer ignore the pressure. An emergency COBRA meeting is called. Not for terrorism, not for war, for healthcare workforce collapse. Inside the Cabinet Office briefing room, the mood is tense. Prime Minister Keir Starmer sits at the head of the table. To his left, Health Secretary Wes Streeting. To his right, Home Secretary Shabana Mahmood. Around them, advisors, data analysts, and senior civil servants. The numbers on the screen are brutal. Current NHS nursing vacancies 47,000 projected. Additional vacancies if 50,000 migrant nurses leave 97,000. That's nearly 1 in 8 nursing positions empty. Streeting speaks first. His voice is strained. Prime Minister, we are facing an existential threat to the NHS. If even half of these nurses leave, we will see ward closures, A&E collapses, and a spike in preventable deaths. The public will not forgive us. Mahmood counters. With respect, Health Secretary, we are also facing an existential political threat. Reform UK is breathing down our necks. If we are seen to cave on immigration, we lose our credibility on border control. The public wants tougher migration policies. Starmer's jaw tightens. The public also wants an NHS that works. They want to be able to see a GP. They want their parents to get care in old age. What good is a tough immigration policy if people are dying in hospital corridors? The room falls silent. Then an advisor speaks up. Prime Minister, there may be a compromise. We could carve out an exemption for healthcare workers. Keep the 10-year rule for other sectors, but maintain 5 years for NHS and social care. Mahmood shakes her head immediately. That creates a two-tier system. It undermines the entire policy framework. And politically, it looks like we're panicking. We are panicking. Streeting snaps. Because this is a crisis. The tension is suffocating. Starmer closes his eyes. For a long moment, he says nothing. Then he looks up. I need options. Real options. Not political spin. I need to know, can we survive losing 50,000 nurses? The chief medical officer, sitting quietly until now, finally speaks. No, Prime Minister. We cannot. The words hang in the air like smoke. Starmer exhales slowly. Then we need to find a way forward. Fast. But before any decision can be made, news breaks that changes everything. At 2:43 p.m. a WhatsApp message goes viral. It's a voice note, 47 seconds long, from a nurse named Justine Mensah. She works at St Thomas Hospital directly across the Thames from Parliament. Her voice is shaking. I just got called into a meeting with management. They asked me if I was planning to leave. They said if I resign, they can't replace me because there's no one left. They asked me to reconsider my options, but here's the thing, I haven't even submitted a resignation. They're just assuming I will. And honestly, they're right. I'm 29 years old. I'm not spending the next decade in limbo. I'm not waiting until I'm nearly 40 to be allowed to call this place home. So yeah, I'm leaving. And I'm not the only one. The message is forwarded thousands of times. It becomes the voice of an entire generation of healthcare workers, young, skilled, and utterly done. By 4 o'clock p.m., the first MPs begin to publicly break with the government. Clive Lewis, Labour MP for Norwich South, stands up in the Commons during an urgent question on NHS staffing. Mr. Speaker, I will not defend a policy that treats healthcare heroes like disposable labor. The Prime Minister must reverse this decision. Today, not tomorrow. Today, he sits down to applause from opposition benches. But it's what happens next that stuns Parliament. Rosie Duffield, Labour MP for Canterbury, stands. Mr. Speaker, I agree with my colleague. And if the Prime Minister does not act, I will be resigning the Labour whip. Gasps echo through the chamber. A sitting Labour MP threatening to leave the party over NHS immigration policy. This is no longer a protest. This is a rebellion. By 5 o'clock p.m., 7 Labour MPs have signed a letter demanding an emergency recall of Parliament to debate the policy. The media calls it the NHS 7. Downing Street is in free fall. At 6:12 p.m., Keir Starmer makes an unscheduled appearance at the Downing Street podium. No advance notice. No prepared remarks circulated to journalists, just the Prime Minister, standing alone in the cold November evening, camera lights harsh against his face. He begins, I want to speak directly to the migrant healthcare workers who are watching this. I know you are frightened. I know you feel betrayed. And I want you to know I hear you. He pauses. The street is silent except for the click of camera shutters. When we announced changes to the immigration settlement system, we did so because we believe Britain needs a fair, sustainable approach to migration. But I also know this fairness cannot come at the cost of our NHS. It cannot come at the cost of patient safety. And it cannot come at the cost of the people who have given so much to this country. Another pause. Longer this time. So tonight, I am announcing that we will be launching an immediate exemption review for healthcare and social care workers. We will work with the Royal College of Nursing, the British Medical Association, and care sector representatives to find a solution that honors both our commitment to controlled immigration and our debt to the workers who keep our health service alive. He looks directly into the camera. To every nurse, every doctor, every care worker watching, we see you, we value you, and we will not let you down. The statement ends. And no questions taken. Starmer turns and walks back through the black door of number 10. Within seconds, the response begins. Nicola Ranger, watching from RCN headquarters, releases an immediate statement. Words are not enough. We need action. We need concrete policy change. And we need it now. Our members are still resigning. The clock is still ticking. On social media, reactions are split. Some call it a victory, a government forced to blink. Others call it a weak compromise. Too little, too late. And in hospitals across the country, migrant nurses watched a statement on their phones during breaks, during handovers, in the quiet moments between emergencies. Some feel a flicker of hope, but most feel only exhaustion, because they have heard promises before. They have been called heroes before. And then they have been abandoned. At 8:34 p.m., Justine Mensah, the nurse whose voice note went viral, posts a video on TikTok. She's in her scrubs, sitting in her car in a hospital parking lot after a 12-hour shift. Her eyes are red. I watched the Prime Minister tonight, and I want to believe him. I really do. But here's what I know. I've been working in the NHS for 6 years. I've been promised better pay, better conditions, better staffing, and nothing has changed. So forgive me if I don't trust another promise. She wipes her eyes. I've accepted a job in Toronto. I start in February. And I hate that I'm leaving. But I can't keep hoping that things will get better. I just can't. The video is viewed 1.8 million times overnight. And in the cold silence of Monday night, the question remains, will Starmer's promise be enough? Or has Britain already lost a battle for its nurses? Because promises don't staff wards. Promises don't hold the hand of a dying patient. Promises don't save lives. People do. And the people are leaving. Tuesday morning breaks cold and grey over London. The kind of November dawn that feels like twilight. The kind that makes you pull your coat tighter and wonder if spring will ever come. In hospitals across Britain, the night shift ends. Nurses peel off gloves, wash their hands for the 100th time, and walk out into the pale light. Some go home to sleep. Others stay for double shifts because there is no one else. The crisis has not ended. It has only paused. Suspended in that strange space between promise and action, between hope and resignation. At St. Mary's Hospital in Paddington, a ward sister named Chamaka sits in the staff room, staring at her phone. The screen shows an email from the Canadian Nursing Registration Board. Her application has been approved. She can start as early as January, but she hasn't replied yet. She looks around the room, at the peeling paint on the walls, at the kettle that's been broken for 3 weeks, at the rota on the board, full of gaps and red ink and desperate rearrangements. She thinks about the patient in bed 7 who calls her my angel, about the student nurse she's been mentoring, who reminds her of herself 10 years ago, about the way the light comes through the windows on the children's ward and makes the drawings on the walls glow. She thinks about home, and she realizes she doesn't know where that is anymore. Across the city, Keir Starmer sits in his office in number 10, reading briefing papers that make for grim reading. Overnight polling. His approval rating has dropped 6 points. NHS England internal memo. Staff morale at an all-time low. Treasury projection. Losing 50,000 nurses would cost the economy an estimated £3.8 billion in lost productivity, recruitment costs and patient harm litigation. And a handwritten note from West Streeting slipped under his door at midnight. We have one chance to get this right. If we lose their trust now, we lose them forever. Starmer knows this. He has always known this, but knowing and fixing are not the same thing. The exemption review he announced is real. Meetings are already scheduled. The Royal College of Nursing, the BEMA, the care sector unions all invited to the table. But the political reality is brutal. Every exemption he grants will be called a U-turn. Every concession will embolden Reform UK. Every compromise will bleed votes. And yet, if he does nothing, the NHS will collapse. Not metaphorically, not eventually. Within months, he stares out the window at the grey London sky and wonders when governing became this impossible. By mid-morning, the first signs of movement appear. The Home Office releases a statement. Vague, carefully worded, but significant. The government remains committed to a fair and sustainable immigration system. As part of the ongoing consultation on settlement reforms, we will be exploring sector-specific pathways that recognize the unique contributions of healthcare and social care workers. Further details will be announced in due course. It is not a reversal, but it is not nothing. The Royal College of Nursing responds within the hour. We welcome any genuine engagement, but our members need certainty, not consultations. We are calling on the government to immediately freeze the 10-year extension for healthcare workers until a full impact assessment is completed. The back and forth continues. Statements, counterstatements. The machinery of politics grinding slowly while real lives hang in the balance, but in the hospitals, something quieter is happening. Patients are speaking up. At Edinburgh's hospital in Cambridge, an elderly man named Arthur writes a letter to his local MP. He is 83. His handwriting shakes, but his words are clear. The nurse who saved my life after my stroke is from Kerala. Her name is Asha. She worked 16-hour days to keep me alive. She held my wife's hand when the doctor said I might not make it. And now you want to send her away? Shame on you. Shame on all of us if we let this happen. The letter is posted on social media by his granddaughter. It goes viral. Within 24 hours, hundreds of similar letters flood MPs' inboxes. Stories of migrant nurses who delivered babies, who caught cancers early, who sat with dementia patients in their final hours and sang them songs in languages the patients didn't understand but somehow felt comforted by anyway. These are not statistics. These are not policy debates. These are love letters to the people who held Britain together when it was breaking. And slowly something begins to shift. Not in Parliament. Not yet. But in the country. A poll released on Wednesday shows that 68% of Britons support allowing healthcare workers to keep the 5-year pathway to settlement. Even among conservative voters, the number is 54. The British public, it turns out, is not as hostile to immigration as the politicians feared. They are hostile to unfairness, to broken promises, to watching people who saved their lives being treated like pawns. By Thursday, the pressure has become unsustainable. 3 more Labour MPs threatened to resign the whip. The Liberal Democrats table an Opposition Day motion calling for an immediate healthcare worker exemption. Even some Reform UK voters begin to waver, calling into radio phone-ins to say, I want controlled immigration, but not like this. And in the quiet corridors of power, deals begin to be made. On Friday evening, 1 week after the policy was announced, the government makes its move. No podium statement this time. No dramatic announcement. Just a press release, issued at 6:47 p.m. Time to miss the main evening news but still make the morning papers, following extensive consultation with healthcare stakeholders. The government has decided to maintain the 5-year indefinite leave to remain pathway for workers in the health and social care sectors. This exemption recognizes the exceptional contribution these workers make to our nation and ensures the sustainability of our NHS. All other sectors will proceed with the 10-year settlement model as planned. It is a compromise, a political calculation, but it is also a lifeline. Within minutes, the Royal College of Nursing releases a statement. This is a victory for common sense and for every nurse who stood up and made their voice heard. But we remain vigilant. We will hold this government to account and ensure this exemption is enshrined in law, not just policy. Across the country, phones buzz. WhatsApp groups explode with messages, crying emojis, praying hands. British flags next to Philippine flags, next to Indian flags, next to Nigerian flags. Relief, exhaustion, disbelief. Chamaka, still sitting in that staff room at Stede Mary's, reads the news on her phone. She stares at it for a long time. Then she opens her email and writes to the Canadian Nursing Board. Thank you for your offer, but I have decided to remain in the UK. Perhaps I will reconsider in the future. For now, I am needed here. She hits send, and then she cries. Not from sadness, not from joy, from the sheer weight of having been seen, but this is not a happy ending. Because 50,000 nurses came within days of leaving, and some still will. The damage has been done. The trust has been cracked. And the NHS remains in crisis not because of immigration policy, but because of decades of underfunding, political neglect, and a society that applauds its healthcare workers but refuses to pay them fairly or staff them properly. The nurses who stayed did not stay because Britain convinced them they were valued. They stayed because they are healers, because walking away from patients feels like betrayal. Even when staying feels like self-destruction, they stayed because of the patient in bed 7 who calls them angels. Because of the student nurse who looks up to them, because of the way the light comes through the windows on the children's ward, they stayed for love, not for Britain, not for the government, not for the policy, for the people they care for, and that is both beautiful and unbearably sad, because a nation that relies on the goodwill of exhausted migrants to keep its healthcare system alive is a nation that has failed its people. Tonight across Britain, those migrants will pull on their scrubs again. They will check medications, take vital signs, hold hands, and save lives. They will do it because it is who they are. But somewhere in the back of their minds, the question will linger. How close did we come to leaving? And what happens the next time? Because there will be a next time. There always is. Policies will shift. Governments will change. Public opinion will sway. And the nurses, the ones who hold this country together with their bare hands and breaking backs, will be tested again. The only question is whether Britain will finally learn to value them before it's too late, or whether one day, when the nation calls for help, it will find that the people who always answered are finally, mercifully, heartbreakingly gone. In the silence of a London hospital at midnight, a Nigerian nurse named Grace finishes her shift. She walks past the hand sanitizer station, past the faded NHS posters about hand washing, past a waiting room where a mother rocks a feverish child. She steps outside into the cold November air, and she looks up at the sky, the same sky that hangs over Lagos, over Manila, over Accra, over all the places these nurses once called home and all the places they might call home again. She takes a breath, and then she goes back inside, because there are patients who need her, and for now, for tonight, that is enough.